Good morning and welcome to your Farm and Home Show. I'm Kristi Shive, and this morning we're visiting with Elizabeth Westbrook. She's the cancer control specialist for the Kentucky Cancer Program. Good morning, Elizabeth.
Good morning, Kristi.
Elizabeth, today we are going to talk about the Colon Cancer Coalition, but first, can you tell us a little bit more about the Kentucky Cancer Program?
Sure, the Kentucky Cancer Program is funded by our state's General Assembly, and it's been around for more than 30 years. The Kentucky Cancer Program provides education, research, and service in our communities. We have regional offices that are located in all the area development districts, and we're out there doing education and encouraging screening.
Doing such wonderful work. Now, Elizabeth, whenever it comes to colon cancer screenings, what should people know?
Well, first of all, they should know that colon cancer is preventable. There are some colon cancer screenings that will find polyps and, for example, a colonoscopy, and the polyps can be removed and thus you prevent the cancer. They should also know that it is able to be detected early, which leads to better treatment options, and that it is curable. So it is beatable.
Prevention and early detection truly saves lives, and that's what screenings are all about.
Yes, it is.
Who should be screened?
Well, generally, we think about people in two categories. There's your average risk category, and that's people between the ages of 45 and 75. And this is very important because American Cancer Society a couple of years ago just came out and said we should start screening at 45. And for years, we've been telling people to get screened at age 50. So these are people who are at average risk. Screening should now start at age 45. And in Kentucky, insurances are required to follow those ACS recommended guidelines. People who are in good health between the ages of 75 to 85 should check with their physician as to whether or not they should still be screened. And then we have people who are high risk, and those people need to be screened perhaps earlier than 45 and also perhaps more often. They're at high risk because they've either had colon cancer or they've had polyps removed, or they have a family history of colon cancer or polyps. And within some families, there are certain familial syndromes that place them at much higher risk of developing colon cancer. And a good example of one of these would be Lynch syndrome, which causes colon cancer and some other types of cancer too. And then also high risk are people who have symptoms. If they notice blood in their stool, a change in bowel habits, perhaps it's weight loss for no apparent reason, or any other symptoms, or if they have ulcerative colitis or Crohn's disease, then they should be screened earlier and more often.
If individuals have questions about colon cancer screenings, how can the Kentucky Cancer Program help?
Well, the Kentucky Cancer Program is spreading the word, and what we're trying to, the information we're trying to get out there is to let them know if they don't have insurance, if they're uninsured, or if they're underinsured, they may be able to get their screenings free or very low cost. And so if people feel like they might qualify, they should call the Kentucky Cancer Link at 1-877-597-4655. And so they really should call to see if they qualify. Now, this is not just for people to be screened, it's also for people who are in need of surveillance colonoscopies. Those people have to be screened more often. And so it's really important that they contact the Kentucky Cancer Link if they think they may qualify for these services.
All right, Elizabeth, thank you so much for being with us today. If you or a loved one needs more information on colon cancer screenings or to see if you qualify for financial assistance, be sure to call toll-free number 877-597-4655.